came out of the hearing room. It was very interesting discussion. There was tremendous support. There must have been 500 people there in support of SB810 and maybe 3 or 4 corporate types against SB810.
Let's talk about what happened today. Maybe we can get some reports.
And where do you live and what do you do?
I live in, most of the time in San Francisco. I do have a home in Santa Cruz, so I'm a bit split allegiances. And what I do is I'm an assistant professor at UCSF. I work at the Institute for Health and Aging and the Department of Social and Behavioral Sciences, and I'm assistant professor in sociology and health policy.
So you were there in the hearing room today when SB810 was having a hearing. What's your reaction to the hearing?
I was indeed. Well, first of all, I was delighted to see so many people supporting the bill. I was very impressed with Senator Leno's very articulate presentation of the bill. And I was also delighted by the people who expressed the reason for their support. In other words, the 3 witnesses, particularly the medical student. I thought he was brilliant. He made a very good case for why single payer is not only the best, but the only way to go, really, right? And I say the only way, that assuming that we want to eliminate financial barriers to healthcare for all Californians, and we want to do so without just going broke, bankrupt, right? Because basically the California fund is at the verge of bankruptcy, if it's not bankrupt already, right?
You mean the California budget?
The budget and the fund, the general fund,
yeah.
The fund out of which comes all the money to pay for health care for all public employees and their families and retirees, right? It was recently reported, for instance, that $50 billion is going to be the bill, pick up the tab for retirees health care. That's just simply unaffordable. And all legislators know that. And the only way to control costs, to dramatically reduce costs in healthcare, and by cost I don't mean any cost, but particularly get a hold of the prices that are out of control. We pay the highest prices on the planet for services that cost a fraction elsewhere. The only way to do that is with the huge market leverage that single payer has. And aside of that, you have basic principles of policy that anybody can understand in 5 minutes. A single payer has the capacity to do, other systems don't do. That is to cut down administrative waste. You stop dividing people up in different pools, and you cross-subsidize. You let the vast majority of people who have lower health expenses subsidize the minority who has higher health expenses. That is true in any system of healthcare, not just in the United States. So cross-subsidizing is a critical part of the power of single payer to control costs. What makes a single payer unique, what it is, with respect to every other health reform option, is that it is a form of social insurance. And social insurance is what the vast majority, if not all the developed countries in the world use. They use social insurance. By social insurance you mean a system whose goal is to eliminate financial barriers to healthcare, not to make profit, as ours. Everybody contributes, everybody plays, and you pay into the system a proportion of your income, which is why the fight is over, how much, what is the percentage, right? They call it tax. And that's fine by me. I don't have a problem with the word tax, although people do. But they don't seem to understand that when you pay that 6% of your salary, that's all you pay into your health care. You stop paying premiums, you stop paying deductibles, you stop paying co-pays. What impressed me the most as a person who has been teaching and studying comparative healthcare systems for years was the several statements, as a matter of fact, by this Senator Hammerstedt, when he said that the only countries in the world that had single payer were Canada and North Korea. I was absolutely dumbfounded. A person on who voters put their trust and in fact pay their salary, just openly lie on their face with such a straight face. I had never, seen it from so close. And it was a double lie, really, depending on what you mean by single payer. If you mean, by single payer strictly nothing but publicly financed healthcare, that is false of at least half a dozen countries that I can think of off the top of my head, because as I said, I've been teaching this for years and studying it as well. In fact, the last one I know of is Taiwan, but there are several others considering single payer. Taiwan, and of course a variety of single payer, Australia. If we want to expand that, and of course Canada, but we want to expand that to include all countries that pay out of publicly financed funds, we have that the only, all the ones that have socialized medicine do have single payer. They in fact pay out of a publicly financed fund. And indeed, all the others that don't have a single fund, but they have several funds that ultimately converge with government oversight, we would have that the only country that qualifies for this senator's claim is us. We are the only ones that don't have some form of public financing of medically necessary care. I would have to throw my academic career out the window if this man were telling the truth, but in fact he was not. So that was honestly what sort of stood out the most of a whole group of legislators and senators basically there. And I think that all of them know that that was simply false. And probably that's what they should have said. They don't own the facts. So if the facts that they're portraying are false, the statements they're making are false, they should be told so. Mm-hmm. I think that it's a responsibility of citizenship to just say that. And that's in fact what we all need to do.
My name's Cassandra Bennett. I'm from San Francisco. It's my first time ever experiencing hearing in the first place.
My name is Craig Williams. I'm active within the local Democratic Party in my area, which is the Haywood Democratic Party organization. And I thought Mark Leno's testimony was very impressive. There was a ton of organizations who went up in support of single payer, and it seems like just a logical way of dealing with a very serious problem that we're facing. It's good for businesses, it's good for unions, it's good for working people. It keeps down just the cost of doing healthcare, and it's something that if it got a fair hearing, and if it were seriously explored in the media, I think the vast majority of people would support it.
James Keys, I'm the Health Program Director for Senior Action Network, and I live in San Francisco, California. California has long been one of those states that has been said to sort of be the exception and never the rule. Well, let's try to be the very first state to bring single payer statewide, so the rest of our nation can know exactly what it's like, and we can do this thing and make it a done deal.
My name is Maya James, and I live in El Cerrito, and I work for the Oakland Public Library.
And so you were at the hearing today in Sacramento. What'd you think of what you heard and saw today?
I thought it was inspiring to see so many people there who really believe in this. I thought it was really good to see medical students there, and as well as a lot of people who represented nurses, unions who work with people every day and understand what it really means. I mean, I had a job for many years that I didn't like at all, but I had health insurance, and I finally chose to do work that I actually enjoy, but I don't have any health care, and it's hard because I'm saving up a little bit of money, but I know if I have any kind of medical problem, all that savings will probably be wiped away.
You ever thought about moving to a country that has national health care?
Yeah, I have thought about that.
Have you seriously considered that?
Yeah, I have, and right now I'm with a partner who has a child, so I'm kind of based here in the U.S. because of that, but I have thought of that.
Yeah.
Yeah.
But I guess the alternative is to fight here for improving our situation, improving our healthcare system.